You are listening to the Horse Radio Network, part of the Equine Network family.
What a beautiful day for horses in the morning.
You are listening to the #1 horse podcast in the world. Here's your entertaining look at the horse world and the people in it.
I'm Dr. Allison Marshall.
And I'm Dr. John Langlois.
And you are listening to the special monthly Chi University episode of Horses in the Morning on the Horse Radio Network for November 26th. Good morning, Horse World.
Welcome to our once-a-month look at traditional Chinese veterinary medicine with the Chi University.
So, John, we have a really cool guest today on our podcast, Dr. Lorena Lloret, who is actually just been elected as president of our World TCVM Association, and she's quite humble about that. But that is a very prestigious role that she just got put into that we learned about in September.
Yes, I'm very excited to have her because just in September, she did a 2-hour lecture on head shakers, and it really opened my eyes. I don't see a lot of these cases, but I feel confident that I can offer some good prognosis and a possibility that we can help these horses. So again, excited to have her, and she has a world of information that can help these horses that have that problem.
Right. I would say based on her lectures in September, I learned a ton too, and I had a whole bunch of take-home information. So let's invite her on the podcast. Here we go.
Very good.
Welcome, Lorena. How are you today?
Hello, Allison. I'm so happy to be here.
John and I have been really talking about trying to get somebody on the podcast to talk about head shaking. And Dr. Lorena Lloret spoke at our international conference in September, and her 2-hour lecture was all about head shaking. And it was just so cool how the universe landed you in our lap very selfishly for our podcast. So we're super happy to have you on to talk about something that you see a lot. And it's really awesome.
Yeah. And by the way, your talk was just fantastic, as she mentioned. I don't see that many cases, but it was very informative, both in both directions, which we'll talk about. But I really thoroughly enjoyed that.
Thank you so much. You're so kind. Yeah, really enjoyed it. Thank you.
So first of all, I want you to say your name because I would pronounce your last name. I know very little Spanish. Isn't it Lloret? Lloret. Okay, with a little bit of a J. Super. Beautiful. And you grew up in Spain, correct?
Yes, I'm from Spain. I'm actually now talking to you from Spain. I am now in Spain, today.
Good. So you spent most of your life there. I'd like you to just tell our horse listeners a little bit about yourself. You grew up in Spain, and you helped Dr. Shea start the Chi Institute in Europe, but from Spain, if I understand correctly. And now you live in Ireland. So can you just briefly tell everybody that little path that you took?
Yes. Life sometimes has different pathways to take you to the point.
Yes.
So, I grew up in Spain. All my family is from here. I studied degree veterinary medicine, and then I traveled a little bit. I went abroad to learn the language English a little bit, and then I started to learn about TCVM. I met Dr. Shea, and then in 2008, it was when Dr. Shea proposed me to establish the Chi Institute of Europe in Spain, which I was not very sure, but he was very sure. So
I understand.
If you know him.
Okay, if you think it's good, okay. If you think I can do it, I will do with you. So and then from there, doing the story a little short, from 2008 to 2021, we were teaching students, veterinarians from all over Europe and also other countries like India or I don't know, many other countries that they came. And then, in 2021, pandemic, changed many lives and also changed our lives. So then we decided to maybe to take it a little bit more simple, you see, because in 2020, by that time, the last 10 years I've been working in the university and in Madrid, and doing only acupuncture, only Chinese
That's cool.
medicine. What,
That's cool.
so, but then we decided it was more like a family decision, right? My husband loved Ireland. I love horses, and Ireland is one of the countries that has more horses as well in the world. And then we thought, okay, why not? Why cannot we just try and see also I want our kids to have an English education, right? To have to have two languages at least.
That's
so
super.
we just try, and then now we are 3 years in Ireland living. But I still coming to Spain. Obviously, the family, also the university. We teach here. Like this weekend, we are teaching certified veterinary acupuncture here in the University Alfonso X in Madrid. So
that is so cool. So it's really neat to hear. I didn't realize that you were employed by a vet school. I think it's mind-boggling and really cool how many places in the world that the Chi Institute teaches, but also how many vet schools. So I'm actually really excited to hear that you were teaching just acupuncture at a vet school. That's really cool.
Yeah. And the Chinese medicine. I established the service of integrative veterinary medicine, but a specialist on traditional Chinese veterinary medicine here in 2000. Cool. Yeah, in 2014 we started.
That is so cool.
And it's now 10 years. And I'm not in the university every day anymore, as I am now with my family in Ireland, but the service is still working, right? They go together with rehab and other modalities, chiropractor, plus the Chinese medicine, every day. Yeah. So it's very good. I love to come back to see them, but it's a very busy. Actually, we have done research together. One of my publications will be in February in the American Journal of TCVM about the research with the university about acupuncture and analgesia in surgeries, really.
And you won't find either, I believe, a veterinary school in the United States that teaches chiropractic in addition to.
That's a really good point.
That's unusual.
It's a really good.
It's unusual. Yeah. Yeah, I'm now so happy that I can go to them. We make a collaboration with the Chi University and the University UX. Then we teach the CVA at the UX premises, at the hospital UX premises. So it's really a good cooperation. Actually, every year, one scholar gets scholarship. One UX university professor or worker, working in the hospital, veterinarian, gets a scholarship to learn acupuncture.
Wonderful.
So our goal is to get it bigger and bigger, so more and more departments involved for integrative medicine. Yeah.
It's really exciting.
So very good. And Lorena, going to our topic, tell us a little bit about why you wanted to present to our international conference 2 hours of talk about head shakers. What is it? Is this something that you see often in your area? Yeah. And maybe just talk a little bit about why that created such an interest for you.
Well, because one of the main problems that I saw when I started my integrative practice in Ireland, it's TCVM practice really, it's these head shakers. It's so often, especially when the spring comes, and the light is more, or even on sport horses. And the people doesn't know. And Western medicine is very weak in that. And sometimes it's like, okay, idiopathic, but what? There is no real cure for that. So I thought, okay, I'm gonna try to see if with the Chinese medicine, let's take the point of the Chinese medicine and see how it works. And it really, really works really well. So,
excuse me. And I mentioned to you earlier during that conference that Dr. Rob Mackay, who's a world famous equine neurologist, recently retired, he had sent me a message and he said, John, if you find a treatment using TCVM for head shakers, please let us know, because our Western approach is not working very well.
Yeah. Because I think the key here is that we see head shaker like a manifestation of an underlying problem, right? And then we you like you and me, and like we evaluate based on this Chinese medicine diagnostic patterns.
Mhm.
And that's the only key, in my opinion, to really get the point, and then head shaking disappears. I mean, it's not more ever manifested. And it's everlasting, because in the 3 years that I am, horses that I treated with head shakers, I find that they're not going back. I mean, they
Wow.
don't, it's not right going back. So but the key is to keep them balanced. So what it means,
Balance.
one treatment every 2 months or 3 months. Then the people is happy to do so, you know?
Absolutely.
That makes so much
Because
sense.
the alternative's no good.
And I'm with John. I don't treat a lot of head shakers in Virginia, but I can say that the ones that I have treated successfully are the people that understand that it's not just a one and done, or it's not even just 4 treatments and done. You know, it has to be spread out, and it has to be a maintenance to keep them balanced. That has really helped a lot for a couple of my patients.
It needs to be tailored, you know,
Yes.
like, because I have seen head shakers that they are like 1 month head shaking, and they try everything, all the Western medications, whatever, no working, and then within a month, once a week, you do the treatment, and the horse very good. But I have seen also head shakers that is like, okay, this is like seasonal, like every spring comes again and disappears in the winter, because it's more photic, right? More related. But even on that case, then it needs to have a maintenance on the winter.
Right.
That's my big thing, no, with the owners. But normally they want it, because at the end it's very devastating. I mean, what can they do? You know, it's no answer. Otherwise, when they start, some cases are really, really dramatic. So
yes,
and you mentioned too that it's so important, just like in any situation with a problem, you have to have the right diagnosis, and then the treatment is tailored based on that diagnosis. So we don't just have one thing that we find is wrong with these head shakers. Each one has to be looked at individually, and same thing we do with we see in the Florida a lot of non-sweaters, and we say, I don't want to see you when the horse can't sweat. I want to see you in the spring, so that we can create the balance so that you don't see it in the summer.
Exactly. That's prevention is the mother of success. Because if you're able to prevent, then no problem, because you keep the animal balance all year long. And I have clients now that they are super, they're Grand Prix, I mean, Olympics, that they understand that. And even their grand, we see each other at least once every 6 or 8 weeks, just to keep them over the top, you know, the best they can. So not everyone like that, but yeah, I try to educate a little bit in prevention.
Yes. Very good.
Well, and I have had absolutely Western vets will call me or text me and say, what's the herbal that you use for this? Or, you know, how do you, can I, it's not just one approach. And it's, I think I think that's the hardest part for us Westerners to understand about TCVM, is that it is, the beauty of it and the power of it comes in the individual diagnosis and addressing the horse's individual needs and problems. That's its strength, I think, compared to Western medicine. It's just not a shotgun approach.
Absolutely. Because it's not about, in this case of head shaking, for me, it's not about, of course, we want to resolve the head shaker, but it's not even the most important, in my opinion. Most important is why head shaking is happening. Why? What is the horse telling us? Yeah, and that we find with the specific clinical sign that the horse is showing us. We know excess, deficiency, whatever. I'm not going to go on that, but that's the key. And then head shaking manifestation, because actually we can differentiate. Even they say there are true head shakers and or false head shaker. But what is the definition really? I mean,
right.
Because the horse is like, okay, I'm not happy, I'm gonna shake my head. Okay, no, but it needs to be up and down. Or now, listen, I mean,
right.
I don't see that such a big difference on that. What I see is that horse is the head shaking is the manifestation that the horse has, and in most In my opinion, the cases that they don't resolve because what happened? Because no consistency. Because the people is like 1, 2, 3 treatments. Okay, it's better. Then something happened, or then the horse they don't follow what we asked to do, and then maybe not to work. But if you follow the steps, then consistency, then success for sure.
Yes.
That's in my opinion. Yeah.
I think I'm as guilty with my daughter's horses as the next person in saying, but that's expensive. Oh my gosh, you want me to commit to all these treatments? But it's either that or don't ride your horse. And it's hard for me, even as a horse owner, I'm putting myself in this category, but we need to remember that, these repeated treatments make our horses rideable. And
it's expensive, but it's more expensive
to not ride them.
Or to put down the horse.
Yes.
Because you need another horse because
Yes,
so,
I do know.
Or how expensive is that horse?
Yes.
Maybe horses that they are already super expensive. And then they start to head shaker. Like this one that I told you, it was like 1 month. And then now he win. I don't know. I'm not a rider, so I don't follow too much.
I'm the same. Too much to do. Yes.
Exactly. I'm TCVM doctor. So, but he has won many, many prizes. Okay, good. It's one of the, he went out internationally and everything. Well, great. But he's still coming, every 3 months. Because otherwise we cannot balance. So what is more expensive? It's more expensive not
to get a new horse.
Correct.
Yep. The other thing that I think is so cool is that when you take one clinical sign like head shaking, and I know we've talked about how that's a clinical sign for a lot of different problems with horses from the Chinese medicine perspective, but you take this one clinical sign and you treat the imbalance, and there are so many other things that get better with that horse. So that's also the cool part, and that's also the less expensive treatment. You're going to rebalance Cushing's before it happens. You might rebalance a tendon and ligament injury before it happens. Do you know what I mean? By balancing the horse out, using one clinical sign, you actually can unmake a lot of things. And I know this is a dog comment, but I remember I did like 20% dogs for the first 9 years of my practice. And I was just amazed that I'd get these paralyzed dachshunds come to me for their back problems, and we would electroacupuncture, and lo and behold, the bald dog would grow hair back. It helped their skin at the same time. So things that we don't think are very related can actually be very related and rebalanced using TCVM.
So Lorena, if you're at home in Ireland and you get a phone call from someone who just understood that you have an effective approach to head shaking and they call you, what is your approach? Certainly you're going to go see the horse, but how important is the history of, how long it's been going on? And in other words, you want to find out a lot about the horse in order for you to appreciate what's going on.
Yeah, sure. They call me, and then, I have different stables where I go and the people come. So the sooner the better. In the case of the head shakers, if they can come or I can go. And then it depends on how acute, for example. It's 1 month, it's 1 year, it's repetitive, it's seasonal, it's something that it's just all the time. When is this happening? That's important, because then we can estimate how acute or how chronic is the problem. And then from there, normally, in general terms, acute problems need more constant treatment, short in time. Like I say, if you have
a more aggressive treatment, yes?
Correct. If you have an acute horse with head shaker for 1 week, then it's better to see that horse every other day on the next week and see how he responds. Then I have had horses that, they're not readable anymore. They just become aggressive, and then head shaker every time somebody's on top of them. They done all the tests, everything, nothing, apparently nothing, but something is there, obviously. And this horse maybe for 3 years. Mm-hmm. And then owner is like, I put it on the fields, but I don't know what else to do. So this horse need one treatment, prescribe herbs, and then do acupuncture, do the herbal, good food, review the food, and then see you in 6 or 8 weeks after the first 2 rounds of herbal has been done.
So you're going to use both the acupuncture and the herbal and some food therapy. That's your principal way. What about the management of that horse and its environment? Is that part of your approach, or just those 3?
Yes, management is important. If the horse is on work or not, and how first we need to balance the horse and then go back to work. Because anyway, if he's head shaker, he will not work. If the animal, every time you're trying to ride or you're trying to hack him, anything is not possible. So the head shaker is something that, at least here, I mean, not here in Ireland, my clients, they put it on the fields, but then, or they put on the net, nose net.
Yes.
With the net, it's better. Yeah, but
Right.
we want it out. So I treat the imbalance, and then gradually we try to bring him back to the normal work without the net.
And do you offer your clients, let's say in this particular case, a prognosis based on what you see in your examination and the history put together? Do you tell them, "Oh, I fix every case, no problem"?
No. I no. I don't fix every case. I don't think so. I just what I do. Okay, see how it goes. First treatment. What I normally do, especially if it's a horse that it lives 3 hours from me, then this happen. I put the herbal, I put the food, I put the management, acupuncture. Like acupuncture open the channels, right? And then the herbal will enter those channels to balance. And then I try, to see the horse the next month, at least once a month for 2 months will be ideal. Sometimes 6 weeks. It depends on my schedule. Sometimes I just can't go to that area. But yes. I find also horses need the time to regulate themselves,
I love that. Yes.
And they no more and faster is better. I don't think so. Sometimes when it's acute, it may happen. But even in that case that the head shaker is only 1 week, you treat in 1 day, and then you treat it on the day number 3, and probably on the day number 6, the horse doesn't want to see you because he's starting to heal, and then he need more time, because horses need time, and they with the tools that we give, they organize themselves. They're special in that way. In my opinion, that's what I see.
That is 100% my opinion too. And it's amazing how many people want to just hammer on the acupuncture. And really what we have to keep in mind is that we are organizing the body to help it heal itself. And nothing rushes that. You have to give the body time to respond to your treatments.
That's especially in chronic, like I say, for how long, shaker? No, this coming every year. Okay. Then we're now trying to balance the best we can. And then we need the patient, to be patient, because time is very important in horses, in my opinion. So every case is different. In every case, I will give different prognosis, and I always say, well, I don't know. I mean, we try. Okay, we try, we balance, and see. At the beginning, it's more economically effort. Of course, because it's the herbs, but also I say to owners, if you're not able to be constant for about 3 months, then I don't think I can help you.
Yeah, I agree. Yep.
Okay, we need to be a team, and we need to be a team.
Yep, I love the way you say that.
So Lorena, when you have your high performance horse that you mentioned, that I think was 1 month, and this is not necessary for a case of head shakers, but I just got a message this morning that I had treated a horse that was in high performance with an herbal, and they said they sent the herbal formula to the veterinarian for FEI, and they said you are prohibited from using that. Do you run into that? I know that's a problem in the States, but do you also run into that as an issue, that the herb you're prescribing may not be show tolerable?
But we have a list. About 25 herbs are FEI not approvable. The rest, they are okay. Yeah.
Just following up on that herbal, and I had actually sent a message to Dr. Shea about we're running into this now because in the context of the herbs, the testing is becoming much more not controversial but complicated. And so we talked, and he said that 5 days. He said just withdraw for 5 days, and that could be your standard. And with all Jingtong herbals, we should be good with that. But those that are competing once, 2, 3 times a month, that doesn't work very well. So I just wanted to bring up that we sometimes run into a problem with, even though we have the right diagnosis and we want a certain herb, it may be prohibited.
Yeah. In the case of the head shakers, we don't have the problem because a head shaker will never compete until it's 100% sound.
Until he's
right?
Good. Right.
It's a great perspective. Yep.
Claro, that's not a problem. The other horses, I always say, okay, if you have the horse and put it on the herbal for 1 month, and then 1 week after, he will be able to compete, and the herbal is still working on him.
Right.
It's still working on him because you balance. So it's
there.
like saying you don't need the horse on herbal all the time. I don't think so. No, in my opinion.
No, that's the beauty of it. I think that once we create the balance can be there for a period of time, depending.
Until something happens. Yeah, because they are sports animals and they are doing things that they wouldn't do in the nature or whatever, So until something happens. Yeah, for sure.
Have you or do you have any experience using, and I say this because I have my own company and the Chi University sanctions this, is using CBD at all for head shakers? Have you had any experience with that?
I don't have experience of that, but I'm pretty sure it will work well because I had experience with the small animal when I was working here in the university here in Madrid. My caseload was bigger on a small animal than horses. And many of the epileptic dogs that I have, we put them on the CBD. One of my colleagues, she's very good with that, But I'm pretty sure it will help for sure.
Well, it's the same system as when you say we use the herbal and we create this balance, and that balance may be there for quite some time. The same thing with the endocannabinoid system. Once we feel the tone of the receptors and get it right, they don't have to stay on it. They can come off.
They don't, huh? You see?
So cool.
It's so cool, yeah.
John, do you have experience with the head shakers with the CBD? I know.
I don't see enough head shakers, but with many, many other cases, some neurologic, and I think in the United States, there's only one company that produces or has a product that is under therapy for seizures in horses. So neurologic problems, I find it to be wonderful, and certainly any type of Shen disturbance or disturbances I use that a lot, and it helps tremendously. And I get such great feedback that, this horse did so much better getting to the show, doing the show, coming back, and just many, many different uses for it.
And give a shameless plug for your CBD, because you are part owner, I think, in a company that makes CBD for animals, and you've got that pretty well tested, and you guys have good dosages and stuff. So why don't you tell our listeners how to find that?
Yeah, well, it's Hemp Up Better Life is the name of our company, and it's got an award-winning strain, an Abacus strain that has been sought out from many of the universities to do their own research, and also the seeds from the plant are being planted in a number of different states to be able to see what the climate conditions are. Can it grow, and can it be in the same quality? And several of the universities have done 2 studies that are major studies, one on arthritis in dogs and the other is on transportation in horses, to be able to calm them and to create this. So some really good studies, and they have sought out our strain to use as their testing.
I'm really interested, John. So we're going to follow this conversation.
Yes, absolutely. So if you have a case, Lorena, that you're working on, and the client says that they want to use a nose net and they want to use a magnesium supplement, and they know of a university where they can do the electric nerve stimulation or EquiPens, or they want to use some pharmaceuticals, ciproheptadine or some other drugs that may be useful for seizures in horses, do you say, yes, please go do what you need to do, or let's focus our TCVM work and see what we do there?
I'm a very open person, you see. So I think that anything that, especially owners, or caretakers of the horses, if they think they ask me for doing something else, I don't think TCVM is an interfering medicine. I think we can help, and the benefits will surplus, so it will not be, it's not a problem for me. And honestly, if I say no, they're going to do it anyway, so I really want to be on the same side. I really want to know exactly what are we doing. I will give my opinion of different things, but let me say also that normally when they come to me, they have tried everything, huh?
Yeah.
They try everything,
Yes.
and they have
That's
everything.
a big part of my practice is I get a call saying that the Western medicine is not giving me the results I want. Can you offer your medicine?
I call it last hope veterinary clinic.
Yeah.
Exactly, we're the miracle makers. But
Yes.
sometimes, yes, sometimes they're like, oh, I read this, I read that. Can I do this? Okay. Yeah, why not? You can try and say, why not? It will not interfere. If it even may help, so why not? I'm an open mind, but I don't do. I do what I do. So I do TCVM. Why? Because that's, I want to control something. You know what I mean? If I
Yes.
do
Right.
too much, I don't. We have a saying in Spanish, like el que mucho abarca poco aprieta. It means like if you try to get to many things, at the end you get nothing.
I love it. Yes.
So
It's
you
called the
need to
shotgun
really,
approach in America.
exactly. So it's like, okay, try. So I focus on TCVM and I try my best. But I'm an open mind person. So that's why I'm very interested on the CBD. Yeah. And I'm very interested to know more and to try. Why not? If it can help, I think at the end it's the purpose to balance and to heal them. So the animal can heal,
I think this goes kind of along with everything we always talk about, but I have learned, I've been doing my practice for 20 years, just chiropractic and acupuncture. And I felt like a lone wolf because I'm in practice by myself. I'm just starting in my area. And this area had a decent amount of understanding that chiropractic and acupuncture worked for their horses. But, people call us and say, can you help this? And I think what holistic medicine has helped me do is to have an open-minded approach about total integration. And I love when my clients say, can we try this? Because I learned from that as well. I learn what can be used to help what issues. Everything is kind of a case-by-case basis. And I just think holistic medicine makes us more open and it helps us out of the box better,
Especially in pathology, like head shakers. It may not work for one, but may work for the other. So why say no?
Yes.
Let's try.
Yes, for sure. For sure.
That's my
and I think we go back and again and create the emphasis that each case is an individual. And so when we do get those calls, saying, hey, I heard that this my friend's horse worked on this. Can you send that to me?
Yeah.
No, we really should see your horse, not because we need a fee, but we need to understand what your individual concerns are.
For sure.
Yeah, exactly. But this needs education. So, but
That's
it's
right.
because they just like, because this is how we have been done for centuries. Like, oh, this is good for me, then it's good for you, then it's no individual, more like a mass.
Yeah.
So same with the animals. So, but I think everybody understands when they say, okay, but I need to do diagnosis because this is very specific for your horse in that moment.
Is your experience that, this head shaking problem is more seen in the European horses than in the American horses? I mean, the parents and horses in the United States, is it more frequent that you see it there?
I have seen definitely in Ireland many head shakers. I think the light hours is important.
Right.
It's maybe also the wind. The
Right.
wind in Ireland, the wind is a constant. I mean, okay, we say 4 seasons in one day, right? That's what we have, 4 seasons in 1 day. And what it means is like everything is fast. The weather, climatic change fast. And we know from Chinese medicine how this can also affect. Also, wood, well, I don't want to go to Chinese, but work or stress work factors on the horse may lead also to that. But also the light hours in summertime. It's insane. Yeah, it's
right. So spring, summer, and the wind is you think a significant factor.
And the wind, I think, is a significant factor. Yeah.
And do you see in the majority of your cases, do you see them having perhaps an excess, a wind component, which we use in traditional Chinese medicine, or do you find that there are more deficiencies?
The more calls I get from head shakers are in the spring and autumn.
And they're excess?
And they are excess. Mm-hmm. They are liver yang risings or, like explosions.
Right. And, we use the 5-element theory in our understanding and our work. And do you find that there's a particular constitution, like, we talk of the wood horse or the fire horse? Do these tend to have, of course, those are the ones that are competing the most, but do you tend to see that more in a certain constitution of horse that they're more prone to it?
Yeah, in wood fire horses. Right. Yeah, right. Definitely. But also there is some populations more like with phlegm, more like weakness on the earth, right? And then they have the phlegm mind. Also, this is important. This is one part, like the chronics, the ones that they repeat. And then it's like, oh yeah, he was head shaking in the summertime, but then in the wintertime he's fine. But but you don't address the origin. You just let the time pass and put the net in the nose,
Yeah.
No, then every year is like cumulative accumulations.
Right.
And at the end become chronic and become weak and become phlegm.
Right. And then so you do see that is sometimes your diagnosis wind damp?
Wind damp heat.
Yes.
Or liver yang rising, stagnation, flame, fire, disturbing mind.
Right. Those are the irritable type horses, the drunken person that's always irritable a little bit. They can be prone to that. That's the reason why we have to tailor these approaches in our treatment to the individual, because you may have one that has an excess condition, that wind, that damp, or the liver is not happy. And then some may also be having deficiencies as well. So we cannot give the same herb to every case.
Exactly. That's also, because my friend's horse has a head shaker, was great. And then I want you to do the same herbal. No, because herbal are actually, it can damage the animal. We know that. Yeah.
Yes. If it's not chosen appropriately.
Exactly. It's not like giving a chamomile tea, okay, which is wonderful chamomile, by the way, but it will not create. And that's something that I try to make the people understand. But in general, is like that.
And so when you're working on a specific case and you've made an approach do you use electroacupuncture and then we do the herbal, and do you also
I don't do electroacupuncture.
No electro, okay.
With head shakers, never.
Right. Okay, good. That's a good point.
Why? And I know there is a study that say, okay, electroacupuncture can improve, especially on the fatigue. But I was chatting with the person that write that, and then she actually told me, okay, look, only 50% of the cases work, other don't work. And that study only 7 horses. So no, we need a big study, okay? I don't think, from Chinese perspective, electroacupuncture is too young. And normally, head shakers are young. Yeah, there is a wind, internal wind. Yeah.
Yeah, so that's the balance between yin and yang. So that's too much yang for the horse to be able to tolerate.
Exactly. It's too much.
And I want to make a caveat there, because I would say that the head shaker that I've treated most recently and most effectively, I used electroacupuncture, but he is I don't know how big, he was a 10-year-old thoroughbred when I saw him, and his head shaking was set off by neck injections. So I felt like there was a huge neck pain component to his head shake. And so you never say never, right? I think I have used some electroacupuncture in some of those cases, and, for whatever reason, I felt like it was helpful.
Okay, I like your point, because you're actually right in the way that we can never say never, and in the way also that head shaking is manifestation. In that case, because the neck issue, right? So you use electro on the neck, and then it's perfect. You reestablish again the chi and the blood flow, and no more pain, and then stop head shaker.
Right.
But the study, I don't see from Chinese point of view the perspective of doing electroacupuncture on a photic head shaker.
Yes, I understand that.
Because that is, like for the, say, like nerve, facial nerve or trigeminal nerve is affected, then we're going to do electrical discharge, and then that's too young really for that. And it's actually in the study only 50% of the cases, and only for 7 horses.
I feel like I use electroacupuncture to help neurologic or neuromuscular things. So I use it for my neck issues. I used it for those paralyzed dachshunds. And man, if the photic head shakers, their nerves are already torqued off. So I think you're correct. In for the photic ones, it makes so much sense not to torque them off more. It's almost like you'd be adding fuel to the fire by doing electro.
Exactly. So I don't do the electro on that type of idiopathic of trigeminal suspect head shakers. But if the head shaker, if the animal is shaking the head, we can say shaking the head because he has a neck issue or he has a back issue or he has pain wherever.
Right.
For sure, you electroacupuncture.
Right.
Because you're treating the root, right? And then
Or you could say the opposite. I'm such a devil's advocate with so many things. You could say that the neck and the back are painful because he's been head shaking. So you clear what you see right in front of you, and then you go deeper. You know what I mean? That's the beauty of it, is that we can take, every horse is different every time we see them. And that's why it's so important to do your Chinese medicine, is treat the animal in front of you and peel the layers of the onion.
Definitely. My one of the, I was thinking now, I was remembering one horse head shaker with also neck problem. I didn't have to use the electro, but I become, I don't know, with the leads and everything, I think I need an assistant for the electro. That's why I'm a stud, and now I do more laser.
Yeah, you were saying that in your lecture. That's cool.
That is faster. Even laser with the head shaker, that is a cold laser, but on the distal points it has worked good for me. So yeah. Even laser is young, so it shouldn't be used.
Yes.
But I have used it. Yeah.
And do you try to, again, this is going to be according to an individual diagnosis, but do you have any diet recommendations for?
You know very well, because if you have a liver stagnation, you're going to use more green leaves or vegetable. I like to do the salads, the salads that we do according to Chinese medicine. Even sometimes when they have phlegm, we can use some orange color or the red berries in the salad for the animal, or the blueberry, for the blood, to move the blood. That I love to use. But also, of course, if it's on pellets or something like based on oats, and oats is so hot and the animal is hot, then don't use the oats, So all these basic rules. Also the grain, I'm not a fan of some grain. I use some chaff that is nice. It comes from the Netherlands. It's called Hartog Digest, and it has different licorice and sunflower seeds, and it has a grass, like it has no molasses. It's high in fiber. And
can you spell that?
It's HART for Tango OG.
Hartog.
Okay.
Hartog made that Hartog digest with beetroot, like with no sugar,
Right.
carrot, apple, crab.
Do you find that a lot of your head shaking cases also do deal with some gastric ulcers or colon ulcer situations in combination?
I find that, yeah, that's in the past. It's like the system of the body trying to escape.
Right.
And then even sometimes head shaking because the gastric issues. So
Yes.
as we say before, head shakers is manifesting something is not right.
Yeah, it's interesting. We had a case many years ago that I got sent out to look at, and I think he was 12 or so, performance gelding, and he would take his head and go from the left to the right in a circle, not vertical, but in a circle all the way around and then down. He would do it in the stall. He would do it out in the field. So, I just finished up working in the acupuncture teaching. I'm sorry, in the chiropractic teaching. So I said, oh, good. I'm going to fix this guy using chiropractic medicine. And lo and behold, we put him on anti-ulcer approach for TCVM, and he stopped doing the head movement.
Yeah, it's amazing how many clinical signs can manifest as one thing. Do you know what I mean? Like, that's not what we think of for stomach ulcers, but it's up to us to keep trying things. And that's where the acupuncture scan comes in, that we can narrow down sometimes, more painful points and figure things out a little bit easier. It's so cool.
Yeah. It's so cool because sometimes, the horse come because head shaker, and then you do the scan, and then, bingo, there you are. You have the liver points and you have the gastric points.
Right.
Or no. Sometimes they like, no, it's been scoped and it's fine. Yeah, but it's not fine.
No.
Right.
Okay, I believe you. You scope him and he's fine, but he say no.
Yes.
Right.
Yes.
This is much more subtle, like subtle. Sorry, my English I think is getting worse and worse.
No worries.
No, you're great. Better than my Spanish.
So, yeah. So yeah, for me it's like amazing, no? And then it's like, then we're gonna treat interior to heal exterior. I think people understand that very good. We need to heal from the interior to manifest externally healthy,
Yes.
And that's the beauty of TCVM, really.
It is. That's why it has such wonderful responses, is that we're doing, and that's such an amazing word is balance. Once that animal has achieved a balance, its yin and yang is balanced, and the organs are comfortable in their function, then we have good health and lack of disease. And again, I think that idea of prevention, and I remember Carla Pastor would be very that, and with her clients, she would say, listen, I'm not going to put out the fire every time. Let's go ahead and set up a once a month visit, once every other month visit, put the horse in balance, and then we don't have to put out the fire all the time.
Exactly. That's the only key. But sometimes it's so difficult to achieve.
Yes.
But because we are not educated in prevention, unfortunately, because Western medicine is not like that. But yeah, definitely. Also the food, very important.
Yes.
It's crucial. It's every day. Every day the horse eats, right? So
right.
Just like us.
Exactly. We have an opportunity to heal every day. And also owners, they like to be involved. At least they like to become part of the process, and they need to be.
Yes.
At the end, it's every day they are with them, or the trainers or the caretakers, whoever is with the horse.
Yeah, and you'll find that everybody enjoys that aspect of a team. And I have never experienced a situation where, let's say I have a particular diagnosis and I say, okay, on the side, you should do this and maybe feed this. They almost always want to be a part of that treatment, and they always try to do the process. I mean, some are a little more difficult than others, but the idea that there's a team working to do the healing is much better.
That's I think is crucial. If I don't have the teamwork, I don't do. I'm like I can't do it on my own. I mean, me and the whole boat. What about every day? If I only see you once every 6 weeks, it's not going to work. Then I give, this is my counseling. This is what I will do if he's my horse, okay? He's my patient. This is what I think needs to be done. But if after 6 weeks, not, then probably I don't see him anymore, So, but normally 100%, well, no, 100 is too much. But 95% of the horses that I see once, I see them twice. And third time I see the horse, so much better.
Mm-hmm.
Probably I don't see him again until maybe 3 or 4 months after.
Yeah, and I think that's Dr. Shea's. A lot of times, someone will say, well, how often do I do this? And, he always responds with that famous word, it depends.
Yeah.
But he typically wants 3 treatments and then a reassessment. So I tell my clients a lot, I said, let's do a treatment. And again, I think it's a wonderful comment that you made. If you have a severe acute situation, maybe you have to be short-term more aggressive and see it very quickly, very often to get it back in balance. But yeah.
Yes, exactly. If it's acute, maybe 2 treatments in a week, probably 1 more, and that's it. You're gonna resolve in 1 week because it's only 1 week problem. But if it's chronic, it takes time. But as you say, also, Allison, you say about economical, it's important. Herbs are not cheap, because they're not. Right. So for me, it's more important to see the horse once. The person follow the herbal recommendation and stick on that for 6 or 8 weeks. And then again, another acupuncture treatment in 6 or 8 weeks, or 4 to 8. It depends on where they are in the island, because I travel our island. So I just can't be there more than once every 6 or 8 weeks. But also the people like it. They like to have the control.
Yeah.
Well, and I loved your description earlier when you said that the acupuncture opens the channels and that way the herbs can get in and work. And I think what I tell my clients is that if I can nail on the head with an herbal, with my good tongue and pulse diagnosis, which is obviously very important to make sure we see the horse. But if I can really be specific about that, it's like a daily dose of acupuncture. And so when you think about it from those terms, it's actually on the cheaper side as well. The herbs are expensive, but for a daily dose of acupuncture, it's pretty cheap.
Exactly. And with the acupuncture, you're like tuning up. No,
yes.
Then you go, and then 6 weeks later, see what you find after the herbs, after the food, after the management of the exercise, whatever they have to do. Okay. And I love that, the second treatment, because many, they're at least they keep on having like 50 or 70% better. And it's like, okay, we are on the way. Don't worry. Then we change the herbal, maybe the pattern has modified, whatever, no? And it's like a process, and we're part of the process. Yeah. But I try to say the owner, look, you are the one, okay? You are the one, because you're giving the herbal every day and you're feeding your horse properly every day, and the horse will respond, but it needs the time.
Yeah, I like this word because I like to dance, but I oftentimes will tell my client, I said, let's dance. Okay. We try a few things, and then we recheck, and then maybe we change it up, another step, another approach based on what we see in those visits. Because I think for the listener, it's important. You don't give a horse a diagnosis for life. You give it a diagnosis for the time you see it. And then the next time you see it after your treatments, that diagnosis may change. And then we're going to change it up. And I have some clients that are very, they don't want to change. It's working. Let's not change. But sometimes it's important to make a shift in your approach, both acupuncture and herbal, because the diagnosis is changing.
Exactly.
I'm laughing because I've seen you dance.
Yeah.
So it brings to mind the Langlois shuffle at our meetings.
Yes. So we dance. And so, Lorena, this has just been fantastic.
Yeah.
I know there's many people out there that have had that experience and maybe have it currently or maybe in the future. I think that they'll appreciate that they have another approach that they can take that oftentimes will be effective if we work together, we have our right diagnosis, and we do our treatments, then we can be successful. So I appreciate you so much in sharing that with everyone.
That was awesome. Dr. Lloret is a real special lady, and to have her on the podcast today. So I'm not sure how everybody can find Dr. Lloret in Ireland, I hate to say, because I know this is a worldwide podcast, but we will put her contact info in the show notes. And Dr. Langlois and I are recording for Chi University, and you can find a practitioner near you at chiu.edu, which is chiu.edu, to find a TCVM practitioner in your area, in America, and really across the world, if I'm not mistaken.
Yes, and that was just such a wonderful interview with her. She just, again, opened the idea that we have another really good, effective way to treat these problem head shakers. So I was all ears, and I said that we could have gone on for another half hour or an hour and talk more, but a wonderful, wonderful practitioner.
Yeah, it was great flow. Great flow. All right. So my quote for our November podcast comes from Obi-Wan Kenobi. The Force is what gives a Jedi his power. It's an energy field created by all living things. It surrounds us and penetrates us. It binds the galaxy together. And I think that speaks for TCVM as well.